Hello everyone, today's presentation is on CMS star ratings for Medicare Advantage and prescription drug plans. CMS publishes star ratings for Medicare Part C and D each year to measure the quality of drug and health services received by Medicare Advantage and prescription drug plans beneficiaries. Also, the star ratings reflect the experiences of Medicare beneficiaries. The star ratings contribute towards supporting CMS's efforts to put the patient first in their programs. Beneficiaries utilize star ratings to find the best plan for them. The system rates Medicare Advantage and prescription drug plans on a scale of 1 to 5 stars, with 1 being the lowest and 5 being the highest. Medicare Advantage plans are given overall ratings on the basis of 5 categories: member experience, customer service, plan performance, chronic conditions, and staying healthy. As far as Part D plans are concerned, they are given overall ratings based on member experience, customer service, plan performance, drug safety, and pricing. Medicare Advantage contracts that are without prescription drug coverage are rated on up to 33 measures, whereas stand-alone prescription drug plan contracts are rated on up to 14 measures. Now we'll talk about what measures are used by CMS to determine star ratings for Part C plans and their data sources. Breast cancer screening, the data source is HEDIS. Colorectal screening, and the data source for this measure is HEDIS. Annual flu vaccine, the data source is CAPS. Improving or maintaining physical health, the data source is Health Outcome Survey. Improving or maintaining mental health, the data source is Health Outcome Survey. Monitoring physical activity, the data source is HEDIS/Health Outcome Survey. Adult Body Mass Index Assessment, the data source is HEDIS. Special Needs Plan Care Management, the data source is Part C Plan Reporting. Care for Older Adults, Medication Review, the data source is HEDIS. Care for Older Adults Functional Status Assessment, again its data source is HEDIS. Care for Older Adults Pain Assessment Measure, the data source is again HEDIS. We have additional measures for Part C plans, and which are osteoporosis management in women who had a fracture. The data source for this measure is HEDIS. Diabetes care eye exam, the data source is HEDIS. Diabetes care kidney disease monitoring, the data source is HEDIS. Diabetes care blood sugar control measure, its data source is HEDIS. Rheumatoid arthritis management, the data source is HEDIS. Reducing the risk of falling, data source is HEDIS/Health Outcome Survey. Improving bladder control, the data source is HEDIS/Health Outcome Survey. Medication reconciliation post-discharge, data source is HEDIS. Plan all-cause readmissions, data source is HEDIS. We still have few more Part C measures left to talk about, and which are statin therapy for patients with cardiovascular disease, its data source is HEDIS. Getting needed care, its data source is CAPS. Getting appointments and care quickly, data source is again CAPS. Customer service, data source is CAPS. Rating of healthcare quality measure, its data source is CAPS. Rating of health plan, its data source is CAPS. Care coordination, again its data source is CAPS. Complaints about the health plan measure, its data source is Complaints Tracking Module. Members choosing to leave the plan measure, its data source is Medicare Beneficiary Database Suite of Systems. On this slide, you will see 4 more measures for Part C plans. Health Plan Quality Improvement Measure, its data source is star ratings. Plan makes timely decisions about appeals. Its data source is Independent Review Entity / Maximus. Reviewing Appeals Decision Measure, its data source is again Independent Review Entity / Maximus. And the last measure is Call Center Foreign Language Interpreter and TTY Availability Measure. Its data source is Call Center Monitoring. Now we will talk about various measures that are used by CMS to determine star ratings for Part D plans and their data sources. Call Center Foreign Language Interpreter and TTY Availability Measure for MAPD, which stands for Medicare Advantage with Prescription Drug Coverage. The data source is Call Center Monitoring. Call Center Foreign Language Interpreter and TTY Availability for PDP, which stands for Prescription Drug Plan. The data source is Call Center Monitoring. Appeals Auto Forward Measure for Medicare Advantage with Prescription Drug Coverage Plan. The data source is Independent Review Entity / Maximus. Appeals Auto Forward Measure for Prescription Drug Plan. The data source is Independent Review Entity / Maximus. Appeals Upheld for Medicare Advantage with Prescription Drug Coverage. The data source is Independent Review Entity / Maximus. Additional measures and their data sources for Part D plans are complaints about the drug plan measure for Medicare Advantage with Prescription Drug Coverage Plan. The data source is Complaints Tracking Module. Complaints about the drug plan measure for Prescription Drug Plan. The data source is Complaints Tracking Module. Members choosing to leave the plan measure for Medicare Advantage with Prescription Drug Coverage Plan. The data source is MBDSS, which stands for Medicare Beneficiary Database Suite of Systems. Members choosing to leave the plan measure for Prescription Drug Plan. The data source is again MBDSS. Drug Plan Quality Improvement Measure for Medicare Advantage with Prescription Drug Coverage Plan. The data source is Star Ratings. Drug Plan Quality Improvement Measure for Prescription Drug Plan. The data source is Star Ratings. Rating of Drug Plan Measure is for Medicare Advantage with Prescription Drug Coverage Plan and Prescription Drug Plan. The data source is CAPS for both plans for this measure. Getting Needed Prescription Drugs Measure is again for Medicare Advantage with Prescription Drug Coverage Plan and for Prescription Drug Plan. The data source is CAPS for both plans. MPF Price Accuracy Measure for Medicare Advantage with Prescription Drug Coverage Plan. The data source is PDE data, Medicare's Plan Finder Pricing Files. The MPF Price Accuracy Measure is for Prescription Drug Plan 2. The data source is again PDE data and Medicare's Plan Finder Pricing Files. Medication Adherence for Diabetes Medications Measure for Medicare Advantage with Prescription Drug Coverage Plan. The data source is PDE, which stands for Prescription Drug Event Data. Few more Part D measures and their data sources are Medication Adherence for Diabetes Medication Measure for Prescription Drug Plan. The data source is Prescription Drug Event Data. Medication Adherence for Hypertension RAS Antagonist Measure for Medicare Advantage with Prescription Drug Coverage Plan and for Prescription Drug Plan. The data source is Prescription Drug Event Data for both plans. Medication Adherence for Cholesterol Statins Measure is for Medicare Advantage with Prescription Drug Coverage Plan as well as for standalone prescription drug plan. The data source is prescription drug event for both of them. MTM program completion rate for CMR measure is for Medicare Advantage with prescription drug coverage plan and for prescription drug plan. The data source is prescription drug event data for both plans. Statin use in persons with diabetes measures is for Medicare Advantage with prescription drug coverage plan as well as for standalone prescription drug plan. The data source is prescription drug event data for both plans. On this slide, you will find references for the material that was used in this presentation. Hope you enjoyed it. Thank you for watching. See you next time.